women that are abusing drugs. Do you understand? Nationally, according to a recent survey, there are about 20 million out of school children as a result of drug abuse in Nigeria. So you will be able to see how important this session is. Another category of people are singles, people who are yet to be married. People who are yet to be married. Are you married? No. So you are vulnerable. You have to be cautious. Those who live in the urban areas compared to those who live in the rural areas. Urban areas in the sense that you live in a populated environment. Do you live in populated environment? No. This environment is not, you are not, though you are not in Ilorin, Ilorin West. Ilorin West. The population I'm seeing here, you can't say you are in the rural area. Do you understand? There are drug hideouts around here. I know we interrogate you, you will say some of them. Do you understand? So that's another reason that you should know that you are what? Vulnerable, and you have to be what? Cautious. Prisoners. You find drug abusers among prisoners. Street children, either those who do not attend school at all, and they are not working as apprentices anywhere, and those who do working even after school hours. Do you understand? They engage in what? Drug abuse, and they are what? Vulnerable. The last one I have listed here, we cannot exhaust everything that we have. I just try to pick some few things so that we can facilitate this discussion easily and faster. The last category is the youth and young people, and you all belong to that category. Do you understand? So you have to be very what? You have to be very careful and shun drug abuse. It means that you are in a stage or at a stage whereby you can easily be introduced to drug abuse, but you have to do everything within your means to shun it. And that is one of the reasons why this session is brought forward. The Almighty Allah continue to guide us. Now, the drug categories. Scholars have categorized drugs into three. The first one is depressants. Drugs that you take that depresses your brain. It makes you dull and sick. Such as heroin. You have watched in movies where people consume cocaine or heroin. After consumption, they just fall on the ground. Do you understand? Those are what? Depressants. The second category are the stimulants. Stimulants. These are drugs that you consume that stimulates your brain and makes you hyperactive. That's why you see some of these laborers. What you feel that they will not be able to do ordinarily, do you understand? Then they will be doing it. Work of 5 people, work of 10 people, they will be doing it. Because of the drugs that they have consumed. So that's the second category. And the last one is the hallucinogens. That one takes you into another world. You will not be conscious of what you are doing. You may be seeing things in dogs and the rest like that after consumption. the Almighty Allah does to us. We have actually discussed various examples of drugs. Now, what are the causes of drug abuse? What are the causes? Why do people find themselves in drug abuse, or how do they find themselves in drug abuse? The first one is curiosity. Curiosity. I want to ask a question. How many of you knows at least one person who abuses drug? How many of you? I'm not saying mention the person's name. Okay, I know somebody who takes drug. Just raise your hand. I know somebody who takes drug. You don't want to raise your hands. No problem. Now, the reason I'm asking this question I asked is that somebody who knows anybody who abuses drug is vulnerable. Do you understand? If you know somebody who abuses drug and they are consuming drug in your presence, one day you may want to explore. Okay, how does it look? Do you understand? If the person does not encourage you to take it, but because you are curious, how does it feel? Okay, just give me a little. Do you understand? Including alcohol. Do you understand? So curiosity leads people into what? Drug abuse. By the time you take it the first time, you want to take more. The second one is influence of peer group. Your friends. If I ask you to raise your hand again now, it will be something else. But those people who know anyone, whether you raise your hand or you don't raise it, anybody who knows somebody who abuses drug has at least a friend who abuses drug. The category of students here, are they of SS1, between SS1 and 3 or what? You already have your own attitude and you are forming your personality already. Then the environmental condition, which I have said earlier. The environment where you live, if there are slums in your environment and you live in a place where crime rate is very high, there is tendency that you will be exposed to drugs. So these are some of the issues. Another one is promotion and availability of drugs. Where they promote drugs and the drugs are accessible, people tend to engage in drug abuse. For instance, I don't know if any one of you was born when they used to advertise cigarettes on the television. Benson and Edges, St. Maurice, Golden Twists. You are welcome, sir. You are welcome, sir. So at the end of each advertisement, there will be an announcement that the Federal Ministry of Health warns that smokers are liable to die young. Immediately after the advertisement, they will advertise, then they will give you that particular warning. But now, they have stopped advertising it. So the promotion is no longer there, but availability. They are not advertising it, but it is accessible and available for purchase on the streets. Do you understand? So where it is available, there is a tendency that people will do what? Abuse such products. Another one is as a means of obtaining creative inspiration. There are certain people who usually consume drugs when they want to get inspiration to do something. Do you understand? They will take drugs. Even as a lecturer, if somebody, those who are used to it, when they consume drugs, they teach better. When they consume drugs, they write better. Do you understand? Musicians, at times when they consume drugs, they sing better. At that point, they will be able to generate songs that ordinarily they will not be able to generate. So some people use it for that purpose. Whoever it works for is not likely to need drugs. Do you understand? Because they will see it as being intertwined with their sources. Then lastly, self-medication, just like we have discussed. Somebody who engages in self-medication is likely to end up with drug abuse. There is this combination that they used to do in Lagos. They call it alcohol. I don't know if you have heard it. Akape, thank you, ma'am. Akape. Who is doing the kicker? Who is doing the kicker? Somebody who is selling drugs by the wayside, just put 2 paracetamol, 2 amala, 2 ibuprofen, 2 ferrous, and the rest. Then they will put everything together. One quick. Tomorrow again, you want to say, that particular, the one you gave me yesterday is very potent. Please give me another one. You are already into drug abuse. Stylish. So, those are the things. Now, we will consider some signs that will let you know that somebody is already into drug problems. We'll be discussing this such that once you identify these symptoms or these signs in anybody around you, please raise alarm. I hope you are getting it. You are actually in this class or in this hall today to learn, isn't it? But as soon as you are learning, you are also taking up a responsibility. Do you understand? To make the society a better place by working with it. Do you understand? So I will say some of them. When somebody changes friends a lot, be careful with such people. They may be into drugs. Because once they have a set of friends that are making the drugs available and these people are no longer making it available, they want to switch into the next they want to go along with the next set of people. So then when somebody is spending a lot of time alone, pay attention to them. Losing interest in favorite things, something that this person sees this bottle of his usual, come and take, then he says he doesn't want. Something is getting wrong. They're not taking care of themselves. A friend about 3 weeks ago showed me a video on the social media where the person was interviewing people who are drug addicts. And I said, so why? The person was just doing all of this. I said, why are you so dirty? I know it's because of Ojaina. That's the concept that the person Ojaina. So you see that she cannot put water on the body and the rest. So the person will be dirty and will be feeling unrest every time. Another one is being really tired and sad every time. The person will be down every time. Then sleeping at strange hours. Sleeping at what? Strange hours. Let's put it at that. Now, what are the public health impacts of drug abuse? Public health impacts of drug abuse, and that is the particular reason why this foundation is coming up with this session. Globally, 3.3 million people die as a result of drug abuse. Annually, every year, 3.3 million people do what? Die as a result of drug abuse. The second one is that it has negative health consequences, ranging from the eyes. It actually blinds some people. Drug abuse or excessive consumption of drugs blinds some people. It can also lead to what do you call it? Lung infection. It can also damage the kidney and the liver, among other health challenges So those are the problems. Again, mental disorder. When you get to psychiatric hospitals, at least a handful percentage of people that are there got there as a result of drug abuse. Some people may be able to recover from it, some others may not be able to recover from it. So you have to be very, very careful. Then it also comes with heavy financial burden on individuals, the family, and the society at large. On the individual, in the sense that somebody who has become drug addict will not hesitate to sell whatever they have. Do you understand? They will put it up and say, give me drugs. It is also a cost on the family, because once they exhaust all their own properties, they will start taking whatever is available for family members and they will put it up. Do you understand? Then again, on the society in the sense that the government has the responsibility, and the public, you have the responsibility of ensuring that everybody is fine. But as a society, if you have somebody that is a youth, a young child that is brilliant, that has a very bright future, and the person goes into drug abuse, is the society progressing or regressing? It is regressing. So it is a big cost for the society. Now, another one is addiction. That's the highest level of unfortunate incidents that comes with what? Drug abuse. Now we have 4 stages of addiction. Addiction is a situation whereby somebody is unable to do what? Is unable to do away with drug consumption, whether illegal drugs or legal ones. For instance, a situation whereby somebody cannot be active when they don't take paracetamol every day, or ibuprofen, is a problem that has gotten to the level of addiction. Then we have 4 stages of addiction. The first one is the exploration or experimentation stage. The discussion I was talking about during when I was talking about curiosity. You want to explore, you want to experiment how a particular drug feels. Then you take it. The second stage is occasional stage. Once in a while, pass me the ganja. Once in a while, let me just take it. The third stage is the regular stage. When you become a regular consumer of what? Of drugs. Then the last stage is the fixation stage. Is the what? Fixation stage, whereby you can never do without drug consumption, and that your comfort and satisfaction lies in drug consumption. So that is the last stage, and that may be a stage of no return. The system of such an individual might be permanently impaired, such that they may not be able to get out of drug abuse and addiction again. So finally, we'll talk about few solutions to drug abuse. The first one is abstinence. Abstinence, run away from it anywhere. Anybody who abuses drugs, move away from them. Move away from them. The second one is to resist peer pressure. You will find people who encourage you and say, no, you are no longer a kid now. Let's go out, let's go and have fun, let's go and play. Run away from them. Another one is fostering strong family relationship. If the threat of drug abuse is coming from the family, it can also come from the family, because if you have an elderly person who is abusing drug, then it means that you have to do what? You have to move away from them carefully. But for the most part, people who engage in drug abuse do not start it from the family. They do not find people, they are not recruited within the family. It is only a few percentage of those who abuse drugs that are recruited that engage in it through family members. So ensure that you have a strong ties with your family, such that you don't get carried away when you relate with people from outside. Then finally, you should seek professional help. Then always obtain education on dangers of drug abuse. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu wa rahmatullahi wa barakatuh. Takbir. You see, when I told you that you're going to enjoy the person that is going to deliver, it is when you now listen that you realize he's a professional in that area. Some of you must have heard a lot of things that you have not heard before from him. And I can see a lot of you are jotting. We pray on God Almighty Allah to increase Doctor in knowledge and wisdom. Allah continue to be with him and his family. You have heard it all. Some of the misconceptions about drug abuse or drug usually, as the lecturer was discussing, we have a representative from the Ministry of Education, representative from the Ministry of Education representing the Commissioner for Education in Kwara State, and that is the person of our father, Lady Honorable Abdurrahim Salahuddin. Salaam alaikum. Our father is saying salaam alaikum to everyone. At the same time, we have the presence of Madam Arike of Sudade, a guidance and counselor. He entered when the lecture was going on. This is how I was So in order not to waste our time, we are quickly going to the question and answer section. You might have one or two questions. I don't know. Entertain more than 3 questions, or let's make it equal. 2 questions from the female, 2 questions from the male, and we are going to make it very snappy so that we can go to another item on the agenda. We have finished the schools that I just mentioned after 11. No problem. And tomorrow is one over. Lecture I just finished now, and the schools are just empty. So you are highly welcome. So if you have 1 or 2 questions, we are going to entertain 2 questions from the female section and 2 questions from the male section. Anyone with question? Anyone with question? Do you have any students? Once someone is raising his hand there. A female is raising a hand. Yes, sir. There's one female raising up her hand there. Please.
What is the meaning of Aristotle?
Is what?
The meaning of Aristotle.
Aristotle. Put it in your mouth, please.
What is the meaning of Aristotle?
Aristotle. Hallucinogen. Okay, meaning of hallucinogen. Yes, number 2. Do you have any other one among the female? Hallucinogen.
Please, what is the meaning of stimuli in relation to drug abuse?
Please, your mouth.
What is the meaning of stimuli in relation to drug abuse?
Stimuli. From the male.
question is that the person that is abusing dog, if the person is elderly than us and we don't have the capacity to talk to him, what can we do?
Good. Another question. Another beautiful question.
When a parent is abusing dog,
Yeah.
is the children is going to stay away from his parents?
Yes, sir. Maybe you answer one and two.
The first question was on hallucinogens.
What more explanation?
Hallucinogens refers to the drugs that people consume that makes them unconscious. You will get into a state of hallucination whereby when they say somebody is seeing vision, do you understand? You will be unconscious, just like somebody that is experiencing that some things that are not real, that are not real. The experience that is beyond reality and outside of this world. Do you understand? You find situations whereby some people say they are seeing angels, or you are seeing people that have 7 heads, long legs, and things like that. Do you understand? Things that are not real, then you realize that you are not in this realm any longer until you get out of that phase and recover from the drug. Is that taking? Yeah. Thank you. Then the second question is on stimulants and drug abuse. We spoke about stimulants as the drugs that you consume that makes you to be hyperactive. They stimulate your body system, then you become more stronger. I gave the example of laborers that will start doing works that are ordinarily meant to be done by 2, 3, 4 people. Do you understand? But they will do it conveniently without any glitch. It is as a result of the drugs that they have consumed. Then on the issue of an elderly person or parents abusing drugs and the children are there. If you have the guts, it also depends on your age and your level of maturity and understanding. If you have the guts to discuss with them, discuss with them. If they are ready to listen, at times when you say some things, some people will flare up. If it is somebody that you know will flare up, the first thing you will start doing is to assist such person with prayers. Do you understand? Then you make additional effort. If somebody you can discuss with, sit them down and discuss with them that this thing is not good, these are the effects of drug abuse, and these are the possible consequences that you may face as a result of this. The implication for the person personally, the implication for the family, the person's reputation, and the survival of the family at large, and even the society. You can outline it. Otherwise, or in addition, get people around, maybe family members, your neighbors, get them involved. If you are of the people who do not pray in the house that go to the mosque, you would have your imam that you can invite to your house that will be able to assist in handling the matter in a more mature and better way. The Almighty Allah continue to guide us in that. Assalamu alaikum.
Thank you so much, sir. Then, in Islam calls us to use wisdom. If you see an elderly person engaging in drug that you think you have had the lecture about it and it's not good. Quran says, Al-Hikmah. You don't say, you are smoking in your head. It's not good. No. You discuss with him. Prophet said, Kullu mudkirin haram. Anything that intoxicates, anything that taking too much of it will intoxicate you. the drop of it is not good. You can quote at least for the person with wisdom. So if you drink Indian hair, maybe 5 grams, you will be intoxicating. Then taking a bit of it is haram. You understand? All this idea, and then your father, your mother, they were the one that sent you to school. You can go to them and say, hey, but Daddy, I want to discuss what we are taught in the school today with you. You'll be happy. The moment you'll be happy that my child is displaying or is showing that I have really spent well on him, that he is studying what I asked him to go and do in the school. My child, come. Want to discuss? We then go side by side or bit by bit, so telling him, yes sir, he said drug abuse, this, that. You will pretend as if you don't even know the person is taking drug. You enlighten him, and your own enlightenment does not say that your daddy will change you. It is Allah that changes people. If you tell him or you educate him or enlighten your daddy, you will still pray to Almighty Allah to change anybody that is doing it. It's only Allah that guides completely. We can only, advise. You know what I'm saying? You advise and you plead sometimes. Daddy, I don't want you to be drinking alcohol again. Why? Why are you taking as much alcohol? Because whenever you drink alcohol like this, you fall in the gutter. My friends will be laughing at you. They will be abusing me in the school. So I don't want you to be doing it again. If your daddy or that daddy is sensible enough, definitely you see that one thing. This is what I'm doing is not good, my child. And I leave it for Allah's sake. It's not you, and that is one reason why you have to be praying for anything you see that is not, appealing to you. You're not happy about it, and Allah will change that condition to normal. Inshallah, we are going to the next agenda on the. We have exhausted that of 7, which is question and answer. We want to listen to our father from the Ministry of Education. In fact, our father was sent by Commissioner for Education. And part of what they are happy, they will be happy that we are doing what we are doing to the students. There will be 1 or 2 words of encouragement that as father, we want to tell us to achieve the achievement of our father. And lot of what we have also had, in cover that he want to start probably message from the Ministry of Education. In a nutshell, we are going to be handing over the microphone to our father to give us words of encouragement. Assalamu alaikum, sir.
Bismillahirrahmanirrahim. On behalf, my name is Honorable Abdurrahim Salahuddin Abdul, representing Ajia Sadat Fukaru, Commissioner for Education and Human Capital. A short speech as a goodwill message. When she told me that I should come and represent her, I just feel I have to put something down to help me to speak on it down. As a research, make know that some youth today are initiated in drug abuse. Some are innocent and some are ignorant of the repercussions of the implication of those three drugs. Before they are initiated, just as some become victims of some groups, which become their family. When they first been by family of those result to lack of parent care, sometimes property. Some of the victims come across this by influence of the friends that they flock together with their various schools and streets. When education becomes boring to them, then they see the school like a prison yard. school authorities often threw out some because of school fees or lack of diligence and integrity. There are many ways the youth abuse drugs today. Some have even gone beyond local drugs, which they believe that are not much active again. Some use flag which is made with bad shit, toilet hole, and some are named review. The result of this is an alarm rate, and youth, they say they are leader of tomorrow. Therefore, the organization is out to give our children in various secondary schools the education by sensitizing them to make them realize that the physiological bad effect of those drugs and to the development of youth stating for the effect of their social background. Friends and the social elite, we have I seek you audition and your total support to this Prince program. Láti lè sọ àwọn nǹkan tí nígbà tí wọ́n sọ fún mi pé kí wá sojú àwọn náà ní wípé àwa olùkọ́ àtàwọn òbí a ní ipa pàtàkì láti kó pẹ̀lú àwọn ọmọ wa. Oríṣiríṣi ọ̀nà làwọn ọmọ wa nísìnyí ni wọ́n gbà ń ṣe nípa drug abuse tómi ọmọ fẹ́ fi mú fún òfin sí sálángá láti lè gba agbára. Omi ọmọ ìwàkiwà kò wá sí ọ̀dọ̀ ẹni tó pọ̀ sí àwọn òbí àti àwọn olùkọ́ iná ló yẹ ká múra sí àwọn ọmọ wa. Tá a bá ti rí àwọn ọmọ wa tí wọ́n ń bá àwọn ọ̀rẹ́ tí ẹ̀ mọ òbí wọn tí ẹ̀ mọ ẹ̀yìn wọn, ó yẹ kí a máa ṣe àkíyèsí kọ́lọ̀ ọba kó jẹ́ kí á jèrè gbogbo àwọn ọmọ tí a bí. Ìlàlá ìlẹ̀dùn sọ́dọ̀ rẹ̀.
That is a goodwill message from the Commissioner for Education. May Allah continue to strengthen the ministry and the commissioner in that ministry and those that are working in the ministry. You have heard it all. Take this message home and take it to your colleagues too, those that you are living in the same environment. And your colleagues that are not here to listen to this, you have been sent. You are the vigilant now to the society to tell them the implication of drug abuse, drug misuse, and other substances. It might not be drug, it might be other substances. Can you listen to what I just said? It has gotten to the extent of people going to the sockaway to sniff it. And part of what the lecturer said was that there are drugs that you do what? You sniff. And when you sniff it like this, you become what? Wild. You become wild. That you will do the work of 20 people. One person will do the work of what? 20 people. Have you watched a social media clip at the time where one person is hitting his head on the iron like this? Bah! Bah! What's the ram that has what cannot do? A human being is doing it. Bah! Bah! In the influence of what? Drugs. It means it's not good. What is not good is not good. It doesn't have any other name than what is not good. Therefore, move away from drug abuse and the usage of other substances that is not drug. Like that what our father said, sniffing. I've gotten a message at the time whereby somebody informed him that one of the students of one university, I will not mention the father said here, he invited him, he's a father rider. He said he should come, that he is going to take him to where Sockaway pits where they are delegating, where it is. They will give him any amount he will take. You just take him there so that we open that thing and sneak it. That is what you want to give him money for. So they are doing it. If you see anybody doing that, you quickly go away from it. So may Allah continue to protect us and our family. Quickly, for just 2 minutes, we are going to listen to from Madam Motiwadekeo. As part of his work, he is a guardian and counselor. He wants to pass some comments, probably on what has been discussed or his own personal experience. Just 2 minutes, inshallah, and you will definitely enjoy whatever he's going to tell us.
Assalamu alaikum wa rahmatullahi wa barakatuh. We give thanks, glorification and adoration to Almighty God for giving us the opportunity to be here today. And I want to salute the principal and the management of this school for giving the foundation opportunity to pass this message across to our youth. At the same time, I want to appreciate the representative of the commissioner here present together with our engineer and for the organizer. I want to appreciate everybody. The topic of discussion today is on drug addiction, drug abuse. In counseling unit, we call it substance abuse. Substance abuse. And what do you mean by substance abuse? Drug abuse is peculiar to drug. And when you are defining drug, it has its own peculiar definition. But when we are talking of substance abuse in counseling, we are not limiting our definition, our scope to drug alone. We are talking about any substance whatsoever. Even if it is amala, that when you take amala to a particular stage, it will affect you. It has become substance abuse. And what is the level of that affection? The level of the affection is for you to be able to do something extraordinary, or behave one way, or talk, or package yourself in a way either to disturb other people or to terrorize your colleagues. Therefore, people that use with this attitude will say, Ojúbọ̀rọ̀ will say that way. Do we need to in the first instance? And the essence of you gathering here or coming to the school is for you to become somebody better in the future. And when we are discussing factors to be considered, if we want our learner to become somebody that is better in the future, we have a lot of factors. One of those factors that the counseling is to preach against is what we call truancy. What do we mean by truancy? Truancy is an act. When you leave home, coming down to the school to come and learn, such a student will not get to the school, or when such a student arrives in school, within the first or second period, we will find the student no more. Or such a student will have left the school or the class premises outside, either to school B, either to the younger garage, or any other place. And when they get, these are what we call truancy. Any student found in low attitude, what is common to them is substance abuse. Ability to go and engage in one or two things that will tamper with their personality and that destroy the name of their family. I want to use the opportunity and the opportunity to me this afternoon to discourage you. I want to discourage you completely. Don't join people in school B. You know what we were school in school B? Some of you are present and that are attending classes as expected are about to students in school A. Students in school A. But to the students in school B, they have their own authority and their own management aside from the management of the school. It may be their senior private, it may be their one of the elders, it may be one of the seniors, it may be their colleagues. We call them students in school B because whenever other students are in the class learning, they will be there to have an hiding place, constituting nuisance and training youth on how to become nuisance to the community. Those are students that are trained to be taught. Those are training students that are trained to steal one thing or the other. They even go ahead to even and become nuisance to the school. Those going there. One of those attitudes that are usually common to students of school B are drinking of all this alcohol and substances abuse that will disturb their personality, that will make them to do something extra that can terrorize others. And some of them, they use to engage this in order to render the community and the school in general into chaos, into problems that will not allow the teaching and learning to take place effectively. Be it tom-tom and cerebral, be it lacasera and whatever substances that can input, that can take in, that will disturb your personality, that will not allow you to, even if you want to read, if you are used with all this cerebral and coffee that can disturb you, that will not allow your brain to settle. Some students will drink because they want to read. They will drink something that when you drink it, you will not assimilate the book you intend to read, and it will turn your attention and your brain to another thing. All those are substance abuse. But I want to pray to Almighty God that at the end of your journey in this school, you are going to become one of the promising students. That we, inshallah, people of this nation will not forget you with your contribution. On the last day, I want to commend the organizer of this program for this beautiful talk. And I want to encourage them to, as you bring this opportunity to Ansarusla, senior secondary school, junior secondary school, others who are there too, at my own cluster, funding community and others, who are expecting you to really extend this type of public enlightenment to their last. Now the confidence.
Before we finally go to the closing remark, we want to listen to the chairman of today's event, the president of Engineer Abdul Taufik Babata. Inshallah, we are going to bring the mic to them. We also tell us one or two things as far as the drug abuse is concerned. Inshallah. So,
thank you, sir. Once more. Thank you, sir, for the beautiful speech and presentation from the commissioner. So I'm not giving vote of thanks. Someone else will give vote of thanks. And I just want to tell our brother that we have people from Bani here also. I mean, we have some students from Bani here. With the last program we had it at Ethical College. That's that artist. So we have students from that artist also coming. We've had one at Socrates before. So we have we take the program. Okay, here now we have students from Anur, from Bani, from Addis Ababa, Al-Tabat, Mount Camel, Government Secondary School, Aduri, and Barakat. I just want to add a little thing to what has been said. I went to secondary school in Ilorin also. I went to CNS College, and we did not have the kind of situation we presently have, where we have a lot of young people who are into substance abuse. But I want to tell you a personal story. When I was in school, of course, I'm still very short, but I was very slim, very skinny. I was in fact, probably I was the smallest in my class, and one of the smallest in my sex. And you know that naturally, people who are bigger, they want to taunt you. You're a small boy, do this. You're a small boy, do that. What a few of the students, when we got to SS3, got into was smoking and drinking alcohol. And we were friends. But I was lucky. I want you to please take this thing, it's extremely important. I was lucky that while I was in GSS class, my mother, she's a nurse, or she was a nurse, she's retired now. She did a course, and the course she did was, her project was on drug abuse. So I was very fortunate. I read one of her textbooks. I like reading a lot. Please, if you don't have the habit of reading, read every good thing you can lay your hands on. So I just saw the textbook, I read the textbook. I can remember the cover of the textbook is yellow. So I read the textbook, and one of the key things I picked up from that textbook is that once you start taking a particular drug or a particular substance that is addictive, it will be very difficult for you to stop taking it. You find people who take alcohol find it difficult to leave. People who smoke find it difficult to stop smoking. In fact, smoking is more difficult to leave than even alcohol, even though both of them are bad anyway. So by the time my friends, some of them started smoking and drinking, but I kept telling myself, of course, drinking was out of it because we knew that as Muslims is haram. At that time, people did not know that smoking is haram because the adverse effect was not really that popular. But I kept telling myself that, do you want to be a smoker in the future? So don't even test it. Don't even say you want to experiment. I can't remember the program, but something that you don't eat, you don't sniff it. You got an idea, something like that. So don't even experiment at all. Now, some of those of my classmates who used to make fun of me, that you are a small boy, you know what I used to tell them? A small boy is somebody who follows what others are doing when they are doing something that is wrong. Because you cannot think for yourself. You have a brain, you are from decent homes, you should be able to think for yourself and do only something that will be good for your future. All these things that have been said about drug abuse, one key we need to also take away is that you may wonder that, okay, someone is taking drugs, it makes him stronger. Is there something wrong with somebody being stronger? You may look at it, okay, I want to gain more strength. Why can't I just take it? It is going to have a long-term harmful effect on your body, on your health. The one we see clearly is people who abuse substances and they become mad. You see them outside. But there are people who don't even become mad, but it destroys their lungs for smoking, it destroys their liver. All these are cafe and some other things. It destroys the lung, liver, causes cancer, and so many other things that are not immediate. So it's beyond just distorting your personality. So back to the story, so I can quickly conclude. They used to make fun of me and now they're a small boy, and I'll tell them no, I'm not a small boy. I know what is right, and I'm going to do what is right. So a few years ago, I met one of those of my classmates who used to drink and smoke. His health is in shambles. He's not doing fine at all. I know he was now telling me, reminding me that I didn't get this small boy, we didn't know that you were actually the big boy, even though you have a small body. So my brothers and sisters, or children and my brothers and sisters, please, if you don't follow what others are doing, the wrong things they are doing, you are the big boy and the big girl. Those who follow others to do what is wrong are only and don't be those who have a small brain so that I can do well in future. So how am I going to that?
Maybe it's better for you to take heed to that advice. To bá sọ wípé àti kékeré láti ṣe kí ni tó bá dàgbà tó ń kọ́ á máa gbà mọ́tà gbọ́dọ̀ sọ. So please, we are coming here to advise you, to give you good advice, and to also enlighten you on that thing that might cause damage to your health. It's not when that thing happens that we now be saying, let us go to the hospital, let's spend money on it. That's just like Oasis does. We go to hospital, we attend to people that have health challenges. But we don't want to continue having people with health challenges. It is when we enlighten people like this that we curb that challenges that may happen to anyone in future. So therefore, please, it is better for you and me to obey to everything that has been said today. May Allah continue to protect us and give us a sound health. So we are going to the last item on the agenda, and that is to listen to a vote of chant or closing remark from one of our brothers on the ITV, Malam Muhammad Shuaib from UITH, University of Ilorin Teaching Hospital. Bismillah.
Assalamu alaikum. Alhamdulillah, wa salatu wa salam ala Rasulillah. We give glory to Almighty Allah to have done all these things. I commend the efforts of our organizers for continuous enlightenment on different topics that will benefit our students. We Allah subhanahu wa ta'ala what they are doing. At the same time, I place the hosting schools to have welcomed this good idea, and students that participated as well. May Allah subhanahu wa ta'ala make this venture be of beneficial to every one of you in attendance and beyond. Alhamdulillah, for all what we have just discussed here, I believe none of us will say he or she is not being carried along. We have listened and understood several things. It is now left for us to put it in our left hand so that it will be useful for us from now henceforth. You see, one of the lecturer here, if I put it like that, just demonstrated the life and personal experience of when he was in school and the effect of the determination of that day as at today. So I want us to attach things we have been learning from our Arabic schools concerning the kind of friends you Muslims. Okay, you Muslims have been taught from the religious perspective. If I may just chip in one Islamic way that we are taught at the madrasa, you are taught this 1 year old nilikewu pe alamu fa'inali ilma za'inu li halihi wabadu wabunuwanu fi kulli muhammadin. That one is contained in Ta'ali to Ta'ali. The sect taught us that we should continue to strive for knowledge, because knowledge will become of beneficial to you. At the same time, it will become your identity in the future for whoever stands by it. Henceforth, all what we are being taught today, if we stick or attack ourselves to it, by tomorrow, inshallah, it will make us become a better somebody tomorrow. So this will be where I will draw my curtain. I pray unto Allah subhanahu wa ta'ala to guide, protect, and preserve us from goodness to this society at large. Assalamu alaikum wa rahmatullah.
In addition, we thank the OC School of Islam. May Allah continue to increase you in knowledge. Invited school too, Al-Nur, we thank you so much for taking our request, for accepting our invitation. Government Secondary School, Bani, we thank you so much. We appreciate your attendance. At least the Iqamah, may Allah continue to strengthen you. After that, we thank you so much for accepting our invitation. Mount Carmel College, we thank you so much. Government Day Secondary School, Ilorin, as well as Barakat Community Secondary School. We thank every one of you and all the staff that follow these students. May Allah in His infinite mercy continue to be with you all and give you safety back to your various schools. May Allah continue to guide you, protect you, and increase you in knowledge. We are going to be joining the curtain for this program by saying Subhanaka Allahumma wa bihamdik wa nashhadu an la ilaha illa anta wa nastaghfiruka wa natubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh. Please, let's female go out first. Well, as a Islamic environment, so that we avoid mix up. We don't want to mix up in an Islamic environment. Empty that is not allowed. Let the female go out first. Please allow our mothers to go out. Please, let our female sisters go out first, for Allah's sake.